All right, today we're diving into a health condition that affects millions of men, a lot of the time without them even knowing it, and it has a huge impact on fertility. But what if I told you that the #1 cause of male infertility is also one of the most fixable? Let's get into it.
So, let's just kick things off with that big question. What is the single most common, and this is the important part, correctable cause of male infertility? The answer might surprise you, and it's what this whole explainer's about.
And the answer to that question? It's a condition called a varicocele. So what in the world is that? Let's break down exactly what we're talking about.
Okay, in the simplest terms possible, a varicocele is when the veins inside the scrotum get all enlarged and twisted up. You can kind of think of it like varicose veins that people get in their legs, but, just in a different, more sensitive spot.
Now, there's a very specific and honestly unforgettable phrase that doctors and patients both use to describe what this actually feels like. And that phrase is a bag of worms. It's a super vivid analogy, right? It really paints a clear picture of what's going on.
I know, that bag of worms description might sound a little weird. But what's really staggering is just how common this condition is. When you see these numbers, you'll understand why it's so important to talk about.
So what's the biggest issue here? It really comes down to fertility. A varicocele is the top cause of having both a low sperm count and sperm that don't swim very well. That's the poor motility part. There's a fancy medical term for it, oligoasthenozoospermia, but that's really all it means.
And this chart, wow, this just lays it all out perfectly. Check this out. In the general male population, about 15% have a varicocele. But look at what happens when you look at men who are struggling with infertility. That number jumps to 40% for guys having trouble conceiving for the first time. And for secondary infertility, it's an incredible 50%. Half!
Okay, so if it's that widespread, you're probably wondering, how do doctors actually figure out if someone has it? Well, there are two main ways they investigate.
First, you've got the classic, hands-on, clinical exam. The doctor has the patient stand up and will just feel the area. Sometimes they'll have the patient cough, because that pressure can make the varicocele easier to detect. They're literally feeling for that bag of worms texture. Then, for the high-tech, definitive proof, they use something called a color Doppler sonography. It's basically an ultrasound that gives them a clear picture and objective evidence that, yep, there's a varicocele.
Now, here's the thing. Once a varicocele is found, it's not just a simple yes or no diagnosis. It actually gets classified into different grades based on how severe it is. This really helps figure out the potential impact and what to do next.
And this table breaks it down so nicely. At the top, you've got grade 3. That's the most severe. It's so large you can actually see it just by looking. A grade 2 is moderate. You can't see it, but a doctor can easily feel it. Then there's grade 1, which is smaller and a bit sneaky. It can only be felt when the patient coughs. And finally, you had the subclinical grade. This one is basically a ghost. You can't feel it at all, and it only shows up on that color Doppler scan we were just talking about.
So, after all that, what is the single most important thing to take away from all of this? It's this powerful statement right here. A varicocele is a huge factor in male infertility, yes, but it is also the most common identifiable and, here's the hopeful part, surgically correctable one. For so many people, that means getting a diagnosis isn't the end of the road. It's actually the first step toward a real solution, and that is why understanding this condition is so incredibly important.